Good afternoon, everyone. Welcome to our hashtag Ask SUNY segment. My name is College Metellus. I'm a student advocate fellow for SUNY System Administration, and I'm a recent graduate from SUNY College at Westbury, majoring in politics, economics, and law. Dr. Riley, I'm getting ready to ask you a series of questions that were submitted in our online portal. The first question is there enough evidence to indicate that vaccines are safe? I wanted to wait and see, but I'm not sure what I'm waiting to see.
Yeah, I understand, the human nature to wait and see, but we have enough evidence now that these vaccines work very, very well. So I would say your wait and see period should be coming to a close very soon because the FDA is going to give full approval sometime in the next 10 days to 30 days for at least two of the vaccines. So that should give those of you who have been waiting no other reason to wait. And the fact is again, the data is so strong that these vaccines are incredibly safe. With every medication, there's potential side effects. I could give you an aspirin, and some of you would have a side effect to aspirin. So side effects are a known issue with any medication. And we know that any medication or any vaccine has the potential to cause side effects. But the side effects are so mild and so inconsequential to one's long-term health that there is no reason why you should be hesitant about getting the vaccine.
Hi everyone, and hi Dr. Riley. My name's Elena Buser, and I am a junior in Stony Brook School of Nursing. I work for the Center for Prevention and Outreach at Stony Brook as a student health assistant, and I'm also on the executive board for my sorority, Sigma Delta Tau. A fun fact about me is that I love to play soccer, and I have actually played since I was 5 years old. So our first question of the day is, what are the risks of taking the vaccine, and do they outweigh the benefits?
Yes, the risk of taking a vaccine far outweigh any perceived risk as opposed to getting COVID. And I know some people are concerned about, well, doctor, I'm worried about side effects. Well, yeah, you should be worried about, but the side effects are manageable. The most common side effects are obviously you get a vaccine, your arm hurts for a little while. I myself, after getting the Pfizer shot, my arm hurt for maybe 2 days, but it wasn't anything out of the ordinary. It felt like someone punched me in the arm, and it went away in 3 days. Some people have fever. I had no fever. Some people feel really washed out. So, I have relatives who've gotten the vaccine and they said, hey, I just had to sleep for a couple of days. That's perfectly normal. That means your immune system is working properly. Some people have no side effects. So the side effects are very manageable. Now, some of you may be concerned about, in the case of the Johnson & Johnson, that there were certain patients who got blood clots. But those blood clots were very easily controlled, very easily treated, and they're less severe than the blood clots caused by COVID alone. So that's the thing. You get smaller, less significant blood clots potentially with a vaccine, but you get life-threatening blood clots if you get COVID. So even if you should, in the rare instance, and this is very rare, get a blood clot because of vaccine, we can treat that much easier than we can treat blood clots that happen in patients who have COVID who've never been vaccinated. Those are very difficult to treat in COVID patients. And they tend to be all over the body, whereas with Johnson & Johnson, it tended to be one particular part of the body that had a blood clot problem.
So another question that came in, the student said, I'm a young adult. I thought that I wasn't at risk for the serious illness from COVID-19. Why do I need the vaccine?
Well, unfortunately, even now, younger people are susceptible to COVID, particularly the Delta variant. This is very different than in the early days in 2020 when the pandemic tended to focus on people who were older or they had multiple medical conditions such as obesity, hypertension, diabetes, etc. But this is different. And this is the problem with viruses, they mutate. That means they change. They change their disguise. And in this case, COVID has changed its disguise and gotten to a more powerful version of itself in the form of the Delta variant. And again, the thing about this is that it's affecting younger people. You probably have heard, there's been patients as young as 4 in the hospital on a ventilator. And that was very rare back in early 20. More commonly, we're seeing 20, 30, early 40-year-olds in the hospital quite sick with COVID. So that's what's different about Delta, is that it's affecting younger people more than even in the past. And that's why, again, getting the vaccine can protect a younger person.
So one of the other submitted questions, which is actually a great question, is, are the available vaccines effective against the variants?
Yes, the good news is, in spite of the Delta variant, the 3 approved by emergency use authorization vaccines as of today are very effective against the Delta variant. And in fact, we now know that many of the folks who are in the hospital and who are quite sick or on a respirator now, well over 90% of those people have never gotten a vaccine. It doesn't matter whether it was J&J, Moderna, or Pfizer. They didn't get any vaccine. Whereas those people who even get mild cases of COVID, their cases are very mild. It's like having a cold for 2 or 3 days if you get a breakthrough case. You don't go into hospital. You don't require a ventilator. You don't require, prolonged, convalescence. So the vaccines are incredibly effective against all 3 variants. All 3 vaccines are incredibly effective against the Delta variant.
So one of the most requested questions is, why does the Delta variant seem so much more dangerous and infectious?
Well, the Delta variant is more dangerous and more effective at making people sick, unfortunately, as compared to the variants that we had last year. The simple reason why, is that the Delta variant is what we call, it's more virulent. That's a technical term in science when we say something is more powerful, it's more potent, it's more transmissive, if you will. It's easier for one patient who has COVID, or one person rather, who has COVID, to transmit it to multiple other people because it's so potent. So you can think of something like soap. The soap is like a weak soap, and then there's a really, really strong soap. Well, the Delta variant is really like a really, really strong soap, and that's why it's so much more dangerous. It's also more dangerous because it's more transmissive, it's more potent, but it's also affecting younger people more so than the variants that occurred last fall, where it tended to focus on those 65 and up. We're now seeing patients as low as 1, 2, particularly in the teenage years, the early 20s, the 30s. That's why we're really worried that this Delta variant is not only more potent, it's hitting younger populations and younger groups of people, pretty hard right now.
How does FDA approval work, and should we be concerned that it is taking so long?
Well, the short answer is no, you should not be worried that the FDA approval process is taking too long. Let me explain the FDA process for how we get all of our medicines and vaccines. The FDA is probably the world's best organization to look at drug development, drug evaluation, and drug safety. It has over a 60, 70-year, maybe 80-year track record of making sure that everything that we take into our bodies is very safe. In the case of the vaccines, it is taking a very rigorous review of all the vaccines to make sure, beyond just the emergency use authorization, but the full authorization, which we expect very soon, by the way, sometime probably the next month, that they're looking at all the data. Every drug that goes to market has to go through what we call 3 phases of clinical trials. So they get all the data from all the patients who have taken vaccines, whether it's the Pfizer, the Johnson & Johnson, or the Moderna. They look at the data. They look how many people had any issues. The good news is there's been very few issues. There's been in the case of the Pfizer vaccine, I myself took the Pfizer. There's been over 200, maybe 300 million doses of Pfizer, 300 million doses of Pfizer, and there's been very few side effects as a percentage. So you can rest comfortably that the FDA is doing everything they can to look at the safety of these vaccines And so far, the safety is off the charts.
So this is the question that I tend to hear a lot. Will the vaccines affect fertility of women or men?
Absolutely not. There is no data, there's no suggestion that these vaccines affect fertility in men or women. And in fact, we've been dealing with COVID for the last, 17 months. Babies are still being born every day, which means that they were conceived 7 to 9 months ago. So no, there is no effect on fertility. And also there's no effect on breastfeeding in pregnant women. The CDC just came out last week to recommend that even pregnant women and breastfeeding women should get the vaccine, because they're seeing unvaccinated pregnant women coming in very sick and sometime succumbing during pregnancy to COVID, which is very tragic. There have been cases all around the country where pregnant, unvaccinated women go to the hospital, and unfortunately, sometimes the mother can't be saved. In some cases, the baby can be saved, or in really bad cases, neither the baby nor the mother can be saved. So again, that's why we now strongly recommend any pregnant woman, any woman thinking about becoming pregnant, to get the vaccine.
Is there anything I can do to naturally protect myself from COVID-19 instead of taking the vaccine? And will exercise and a healthy diet keep me from getting it?
Well, in general, obviously being the healthiest you can be is always a prevention against any disease. But in this case, it's not the only answer. So no, you still should exercise, eat properly, good nutrition, get enough sleep, etc. But here again, viruses are invisible to us. You could be the healthiest person, in a building, in your dormitory, in your office, and you get exposed to someone who is coughing, and they are just spewing viral particles into the air, and then you walk through that air. Doesn't matter how healthy you are at that point. If you breathe in the particles from someone else, you have a high likelihood of getting COVID.
With all of the news about breakthrough infections, how can we still trust that the vaccines work?
Well, again, breakthrough infections are always expected with any vaccine, but the percentage of breakthrough infections is like 0.001%. Out of 300 million doses of Pfizer given worldwide, there's been less than 1% breakthrough infections. But the good news is the breakthrough infections tend to be very, very mild. They generally don't require you to go in a hospital, don't require you to be laid up for long periods of time. So again, we're seeing breakthrough infections in immunocompromised people, and that's why the FDA just recently said, hey, if you have an immunocompromised condition, such as recent cancer, or you've had an organ transplant, or you have HIV, or you have multiple sclerosis, we know that your antibody levels tends to drop a little faster than others. So therefore, we're recommending a third shot for immunocompromised as of today. We know at some point we're all going to need a booster. That was expected too, by the way. That is no big news. It's just the issue of when we will need a booster. Will we need a booster in 3 months from now, or in 6 months? And remember, COVID is not going away. We will likely be in a period of time for the rest of our lives where we have to get a COVID shot every 1 to 2 years. That's just the nature of way that viruses and nature and the natural habitat of infectious diseases happens in our globe. So no, we have to learn to live with COVID, and getting a vaccine is going to be part of how we live with it. Whether it's 6 months from now, every 2 years, every 1 year, we should all get comfortable with the idea that we're going to need boosters at some point.
So one of the last questions that I can actually answer myself is, why did I get vaccinated and why do I think it's important? So I got vaccinated because I wanted to help protect some of the older members of my family who have some underlying conditions, and I wanted to gain a sense of normalcy back. And I think it's important that most of the population be vaccinated so that way we can get back to doing so many of the things that we enjoy that we couldn't do during the pandemic.
So we've reached the conclusion of our segment. I would like to thank all the students who submitted their questions to be answered by Dr. Riley. I would like to thank all the viewers for watching, and most of all, I would like to thank Dr. Riley for giving all his time and expertise to educate the SUNY community. Thank you for watching.